ఈ రోజు నేను ఇక్కడికి రావడానికి మెయిన్ రీజన్ ఏంటంటే ఇట్ ఈస్ వెరీ నైస్ ఇనిషియేషన్ ఫ్రమ్ Vignan's side to vaccinate, at least to create awareness among you, because cervical cancer is one of the major burden of female cancers in our population because of various reasons which I am going to tell you. And first part of my presentation is not for you, it is for your mothers, your elder sisters, for their health. And the second part is useful for all of you. So just listen and imbibe all the information, store it in mind, go home, tell your, explain to your mothers, sisters, whoever is there at your home. Okay? Yeah. So these are all the statistics. Out of 1 lakh, okay, we are having cancer incidence of 22 women per year in India. So our total global incidence is, let us say 100, 25% of 25 cases are getting diagnosed in India. Okay, and out of 100 cases who are dying from cervical cancer, 25 cases are from India. So we are almost contributing to 1/4 of total global burden of cervical cancer. So which is very, very huge. Okay. So there are reasons, but before going to all that part, previously we used to have cervical cancer in the first place, but because of change in dietary habits, change in hormones, change in our physical activities, stress levels, and all those things, now breast cancer has come to first place, and second cervical cancer has gone to the second place. The reason for this is because we are having more and more awareness programs like this, screening programs for cervical cancer, because we can screen with a very simple test so that we can diagnose cancer in the early stages. Okay? So you have to remember this point, 25% of all global deaths due to cervical cancer, they are from India and we are suffering it. So this line, same representation. So this is rest of the world is only 75%, India is 25%. So how many of you know either your relation or your family member suffering with cancer? Any of you who are sitting here? ఎవరికన్నా ఇంట్లో క్యాన్సర్ కానీ తెలిసిన వాళ్ళలో కానీ రిలేషన్లో కానీ ఎనీబడి హూ ఈజ్ సఫరింగ్ ఫ్రమ్ క్యాన్సర్, యూ కెన్, యా, నో, ఇట్ డెఫినెట్లీ ఇట్ షుడ్ బి మోర్. ఐఎమ్ కాన్ఫిడెంట్ బికాస్ so one of our known persons, they are suffering from cancer. That is the major burden right now. I think this side it is free, very healthy, good. So the main cervical cancer symptoms are, one is, this is, I am telling you, this is all for your moms, sisters. Okay, so just listen to this very carefully. So unusual vaginal discharge, abnormal bleeding, heavy long menstrual cycles, and discomfort while urinating, and loss of bladder control. Am I okay with English? Because some of medical terms are there. Okay, I'll explain in Telugu also. So menstrual cycles ఎక్కువగా ఉండడం కానీ, వైట్ డిశ్చార్జ్, ఓకే, అట్లా ఉండడం కానీ, లేకపోతే యూరిన్ టైంలో డిస్కంఫర్ట్ ఉండడం కానీ, వెయిట్ లాస్ కానీ, ఓకే, సో లోయర్ అబ్డమెన్లో కొంచెం డిస్కంఫర్ట్ కానీ, బ్లాడర్ డిస్టర్బెన్స్ అంటే యూరినరీ డిస్టర్బెన్సెస్ కానీ, ఇట్లాంటివి ఏమన్నా ఉంటే కనుక దట్ కుడ్ బి వన్ ఆఫ్ ద మేజర్ సిమ్టమ్ ఆఫ్ సర్వైకల్ క్యాన్సర్. ఇఫ్ యు సీ, దిస్ ఈస్ ద ఫిమేల్ జెనిటల్ ఆర్గన్స్. సో దిస్ ఈస్ యూట్రస్, దీస్ టూ ఆర్ ovaries, దిస్ ఈస్ యూట్రస్. The lower part we call it as cervix, where generally this cancer arises, and the lower part is vagina, and this is the os, what we see. Okay, so here the cervical cancer comes. This is all uterus, these two are ovaries, and this is the os. So if we have any of these symptoms, generally in the early stages we present with the upper symptoms like discharge, mainly most common symptom is discharge or leukorrhea. That means white discharge. So as the disease progresses, okay, it goes to the other organs also. Because of that, we will have this bladder control, means urinary disturbances and fatigue because of anemia, because there is so much of blood loss, and pelvic pains, weight loss, and pain in the leg. So those are all the also symptoms. So generally ఈ symptoms కనబడుతుంటాయి మనకి. So coming to ఇందాక మేడం చెప్పినట్లు ప్రివెన్షన్ ఇస్ బెటర్ దాన్ క్యూర్, దట్ ఎవ్రీబడి నోస్, బట్ నో వన్ ఫాలోస్. ఓకే, ప్రివెన్షన్ ఇస్ బెటర్ దాన్ క్యూర్ అంటే మనకి ప్రైమరీ ప్రివెన్షన్ వచ్చేసి ఈజ్ ఆల్వేస్ వ్యాక్సినేషన్. ఐ హోప్ మోస్ట్ ఆఫ్ యూ గాట్ ఆల్ యువర్ వ్యాక్సిన్స్ లైక్ హెపటైటిస్ బి, మీజిల్స్, మమ్స్, రుబెల్లా, ఎంఎంఆర్ వ్యాక్సిన్స్ కానీ మిగతా అన్ని ఆల్ టైఫాయిడ్, డిటిబి వ్యాక్సిన్స్, ఎవ్రీథింగ్ యూ మస్ట్ హ్యావ్ టేకెన్. అలాగే నౌ our central government is also planning to incorporate this HPV vaccine into the immunization schedule. So from 9 years of age, okay, you should have 2 vaccines. So from next year onwards, probably tomorrow, the February 1st bill also, they are considering to implement this one. So the primary prevention is vaccination, and next comes the secondary prevention, means screening. Screening means diagnosing or looking for the signs of disease when the symptoms not appeared. అంటే మనకి లక్షణాలు బయటికి తెలియకుండా బాడీలో ఏమైనా సెల్స్ ఉన్నాయా లేదా అనేది చూసుకోవడాన్ని స్క్రీనింగ్ అంటారు. ఓకే, సో ఈ స్క్రీనింగ్ అనేది సెకండరీ ప్రివెన్షన్. వన్స్ స్క్రీనింగ్ స్టేజ్ దాటింది అంటే ఆల్రెడీ క్యాన్సర్ మీకు విజిబుల్ అయినట్లు, దానికి వీ హ్యావ్ టు స్టేజ్ ఇట్, ట్రీట్మెంట్ చేసుకోవాలి. ఇఫ్ ఇట్ ఈస్ నాట్ క్యూరబుల్ దెన్ ఆబ్వియస్లీ ఇట్ విల్ గో ఫర్ స్టేజ్ 4 పాలియేటివ్ కేర్, అంటే జస్ట్ సిమ్టమాటిక్ ట్రీట్మెంట్ వరకు. So ikkada this is the main point, if not this one. So this is for you people, and the screening is for your moms, sister, elder sisters, like, okay. And the same, the screening part, as I said, the first part of presentation is not for you, it is for your moms, okay. So mothers sitting at home, so probably you can tell them that there are 4 screening tests available. The one is pap smear. This we used to do previously. Now everywhere we are doing this LBC, liquid based cytology. Okay, and if we can do with human papilloma virus DNA also, if it gets tested, okay, that is also available in some of the centers, not all the centers. So we can do these tests for screening. Okay. So how the screening is done is coming to how the cancer appears. Okay, so if you see like this, what we do, okay, so we'll make the patient lie down on a couch, and we'll see whether how the cervix is, how the lower part is. Okay, so this is how we do. When we see like this, how it appears is this one. This is the normal epithelium. Suppose if you open your mouth, everything looks pinkish, smooth, okay, without any irregularities. That is this one. Okay, the same appears in the cervix also. So once cancer starts and if it goes like this, it goes to the next level. This is low grade pathology, and then it goes to the high grade pathology, okay, and then it becomes the cancer. So generally this is what the cycle happens. Okay, so starting from here, it goes like this, and then it becomes high grade, and then it becomes cancer. So the same representation here, this is the normal epithelium. The first upper half what you have seen here is this one. Okay, this is normal, and once one cancer cell appears here, then it propagates, it divides, it makes other cells also. All the cells will be replaced with cancer, and once it breaches this part, the basement membrane, the breach, okay, once the breach happens, then we call it as cancer. Okay, so from this point to this point, okay, it takes almost years together, 10 to 15 years it takes. Okay, so when we can screen with the screening test happens, and when we can diagnose the abnormality in this stage itself, the CIN1, CIN2, CIN3. So till this part it is precancerous. It is not a cancer, it is precancerous. So once the basement membrane, once the base is breached, then we call it as cancer. Then cancer starts spreading from this stage, okay. Till it is here, it won't spread anywhere, and it is easy to diagnose in this stage with simple pap smear what I have shown here, like this. So what we do is, we'll make the patient lie down, we'll just do a small brush like thing will be there, we'll put it in the space, and we take the smear, put it on a glass smear, and we see it in the microscope, okay. So this part takes hardly 5 to 10 minutes of time. So if we can see up to this point, okay, then it is easily treatable and easily curable. Once this happens, then it is we have to go with all kinds of treatment like surgery, radiation therapy, chemotherapy, all those things, which are very costly, and it is associated with a bit of side effects also. So who has to get this screening done? Means up to 21 years there is no pap smear, okay. From 21 to 29 years or up to 65 years you have to get pap smear done every 3 years, okay. If the test comes normal, then for next 3 years you need not do any pap test, okay. So why 21 years? Why not 30? Why not 15? So generally ఏంటంటే మనకి previously we used to have girls అందరికి 21 years వస్తేనే మ్యారేజ్ చేసేవాళ్ళు, దెన్ ఓన్లీ ద సెక్షువల్ ఇంటర్కోర్స్ స్టార్ట్స్, ఓకే. సో అప్పుడే మనకి ఈ హ్యూమన్ ప్యాపిలోమా వైరస్కి ఎక్స్పోజర్ ఉంటుంది. సో దట్ ఈస్ వై దే హావ్ టేకెన్ ఇట్ as 21 years, okay. So if somebody gets married at 18, then probably from 19 they can get pap smear done, okay. So the moment the sexual activity starts, your screening also should start, okay. So from 21 years to 65 years, okay, the pap smear should be done once in 3 years if the previous test is normal, and if at all, if we do a pap test here today, if there are some minor changes or any low grade changes, then next year we should do, okay. It is not 3 years. If normal pap smear, then after 3 years. If there is some change in the pap smear, then every year, okay, till the pathology looks normal, the slide looks normal. So after 65 you can stop, okay. So as I said here, if any abnormal results and post immunization schedule, post hysterectomy, okay, so all those things you should be, there are some exclusions, but generally this is what we follow. So risk factors, what are all the risk factors for cervical cancer is, the major is human papilloma virus, that is all about we are talking now, and having many sexual partners, having unhealthy sex, and smoking, which is bit less in our community, weakened immune system, okay. So this is also one of the major contributor, because if you don't eat properly, if you don't take healthy diet, obviously your immunity will come down. Anemia is also one of the risk factor for cervical cancer, not only HPV, okay. So having what do you call the fast food diet, it won't give you any strength or any immunity, okay. Your taste buds will be satisfied, but it is not useful for you. So, and giving birth at a very young age and several pregnancies, this all means this is more sexual activity. More sexual activity means more HPV exposure, then there is more chance of getting cervical cancer. So he is the scientist who got a Nobel Prize for discovering HPV is the cause for cervical cancer. And so what is the rationale for vaccination? Why should we get vaccinated? So natural infection means there is weak antibody response. You should know about what is antigen, antibody, this is all medical terms. Antigen means the virus or the outsource infection what we face, those we call it as antigen. In response to that, our body produces some antibodies, okay. So if natural infection, then the antibody response is much less, okay. So if we give vaccination, okay, because if we inject, it goes throughout, okay, and there will be more antibody response, more immunity will be developed against the same pathogen, okay. So that is the reason why we vaccinate with all dead virus, or suppose you take oral polio vaccine, okay, some live vaccines will be there, some dead vaccines will be there, inactivated vaccines will be there. So with all that, we'll have more higher buildup of immunity, so which is stronger. So that is the reason why we give this HPV. So yeah, so this is the visual representation. If you get infected with HPV to that cervix area, and the response will be restricted to that point. If we give vaccine, it goes into the blood and it induces more antibody response and more stronger immunity will be developed. That is how we give that is a reason why we give the vaccination. So who should get vaccinated? Okay, this is all useful for you. So what are the cancers which HPV cause? Okay, human papilloma virus ante only cervical cancer ana inkem cancers cause cheyada ante there are number of cancers. So almost all cases of cervical cancer are caused by human papilloma virus. Let us say 100 cancers తీసుకుంటే 90 are because of HPV. Remaining 10 probably, as I said, more say probably unhealthy behavior కానీ సెక్స్ కానీ లేకపోతే ఎనీమియా కానీ వీకెండ్ ఇమ్యూన్ సిస్టమ్ కానీ దీనివల్ల. And mouth cancers, that is tonsillar cancers, are caused by human papilloma virus. And vaginal and vulvar cancers also are caused by HPV. And genital warts, this is a benign condition, it is non-malignant condition, but there is something genital warts, we call it as warts ante chinna chinna lesions ఉంటాయి genital organs మీద, వాటిని genital warts, పులిపిరి, యా అట్లాంటివి, నాట్ ఎగ్జాక్ట్లీ పులిపిరి, అట్లాంటివి ఉంటాయి. ఓకే, సో పెనైల్ క్యాన్సర్స్ ఇది మగవాళ్ళల్లో ఉంటుంది. అండ్ యానల్ క్యాన్సర్స్ 80 to 90% ఆఫ్ క్యాన్సర్స్ ఆర్ ఆల్సో బికాస్ ఆఫ్ హ్యూమన్ ప్యాపిలోమా వైరస్. అందుకని హెచ్పివి వ్యాక్సిన్ అనేది ఓన్లీ అమ్మాయిలకే కాదు, అబ్బాయిలకు కూడా వేయచ్చు. ఓకే, మీ ఏజ్ గ్రూప్లో ఉన్న 9 to 14, ఐ విల్ టెల్ యూ ఏజ్ గ్రూప్. సో ఆల్ దీస్ క్యాన్సర్స్ ఆర్ కాస్డ్ బై హెచ్పివి. బట్ మనకి మౌత్ క్యాన్సర్స్ ఇవన్నీ మెయిన్లీ బికాస్ ఆఫ్ టొబాకో వస్తాయి, అందువల్ల దానికి ఎక్కువ స్ట్రెస్ చేస్తారు కానీ, బట్ ఆల్మోస్ట్ ఆల్ కేసెస్ ఆఫ్ సర్వైకల్ క్యాన్సర్ ఆర్ బికాస్ ఆఫ్ హెచ్పివి. సో దట్ ఈస్ వై వీఆర్ స్ట్రెస్సింగ్ మోర్ అండ్ మోర్ ఆన్ హెచ్పివి వ్యాక్సినేషన్ టు గర్ల్స్. సో ఎంత ఫ్రీక్వెన్సీ వేయించుకోవాలంటే, ఇఫ్ ఇట్ ఈస్ 9 to 14 years, then 2 shots are enough. 2 doses, one is now and one is after 6 months. Minimum 5 months gap undali. That is why we tell after 6 months is the second dose. So if before 5 months ఏదన్నా వ్యాక్సినేషన్ జరిగింటే కనుక పొరపాటున, then you should take the vaccine after 6 months gets completed. సో 15 years వచ్చిన వాళ్ళందరూ 3 doses వేసుకోవాలి, 14 అనేది సరిపోదు. సో 3 doses, it is just to mount the antibody response. Okay, the first dose is for today, second dose is after 2 months. Minimum 6 weeks ఉండాలి ఫస్ట్ డోస్కి సెకండ్ డోస్కి. ఓకే, అండ్ థర్డ్ డోస్ ఈస్ ఆఫ్టర్ 6 months. So this is the recommendation about the vaccination schedule. Can vaccine be taken during menstrual periods? So yes, menstrual periods appudu kuda vaccine తీసుకోవచ్చు. Okay, so there is no problem. So the answer is yes. And can pregnant woman, lactating woman take vaccine? Yes or no? So far the recommendations won't accept. Okay, and pre-existing HPV infected persons take vaccine. So already HPV infection ఉన్న వాళ్ళు కూడా వ్యాక్సిన్ తీసుకోవచ్చా? Yeah, so because probably they might have got infected with other strain of vaccine, like మీకు కోవిడ్లో కూడా మీకు ఫస్ట్ స్ట్రెయిన్ నాకు గుర్తులేదు ఏంటిది, డెల్టా, ఆ తర్వాత ఒమిక్రాన్, తర్వాత ఇంకోటి ఏదో వచ్చింది. సో ఇట్లా ఉన్నట్లే మీకు హెచ్పివిలో కూడా యూ హ్యావ్ స్ట్రెయిన్స్. సో 16, 18, దెర్ ఆర్ ఆల్మోస్ట్ 9 strains are there, out of which 2 causes benign. Okay, remaining 7 causes cancer. Okay, so అట్లాగే ప్రాబబ్లీ ఇన్ఫెక్ట్ అయిన పర్సన్ సమ్ అదర్ స్ట్రెయిన్ తోటి ఇన్ఫెక్ట్ అయి ఉండొచ్చు, బట్ దెర్ ఆర్ సమ్ అదర్ స్ట్రెయిన్స్ ఆల్సో ఫర్ విచ్ వ్యాక్సిన్ విల్ బి ఎఫెక్టివ్. సో వీళ్ళు కూడా తీసుకోవచ్చు, ద హెచ్పివి ఇన్ఫెక్టెడ్ పర్సన్స్ కూడా వ్యాక్సిన్ తీసుకోవచ్చు. సో కెన్ వ్యాక్సిన్ బి గివెన్ టు ఏజ్ గ్రూప్ ఆఫ్ మోర్ దాన్ 26? నాకు చాలామంది క్యాన్సర్ పేషెంట్స్ వాళ్ళ అటెండెన్స్ వచ్చి who are 40, 50, ఓకే, వాళ్ళు వచ్చి అడుగుతారు నన్ను, సో కెన్ ఐ టేక్ ద వ్యాక్సిన్ అని. సో మోర్ దాన్ 26 ఇట్ ఈస్ ఆఫ్ నో యూస్, బికాస్ ఆల్రెడీ సెక్షువల్ యాక్టివిటీ అంతా స్టార్ట్ అయ్యి ఈ హెచ్పివి అనేది ఎక్స్పోజర్ వచ్చేసి ఉంటుంది కాబట్టి, ఓకే, మోర్ దాన్ 26 is not much use. Instead you can go for the screening test which I told you in the last slices, okay, which is hardly a simple 10 minutes test. Once in 3 years we can get it done. So after 26 there is no much use. You can take it if you have money, but there is no use. And can women, this is the most important one, can a woman stop screening after vaccination? No, because it is not 100% effective, the vaccine. It is 80% effective, depends upon the valent vaccine. That means whether we have given bivalent, quadrivalent, 9-valent. Okay, నేను ఇందాక చెప్పిన స్ట్రెయిన్స్ నెంబర్ని బట్టి 2 స్ట్రెయిన్స్ ఉంటే బైవాలెంట్ అంటాం, 4 స్ట్రెయిన్స్ ఉంటే క్వాడ్రివాలెంట్ అంటాం, 9 స్ట్రెయిన్స్ ఉంటే 9-valent vaccine. Okay, depends upon that you will have the efficacy like 80 to 85% or 88%. So remaining 12% you can get infected, okay, you can get affected. So అందుకని వ్యాక్సినేషన్ అయిపోయిన తర్వాత కూడా you are not supposed to stop screening, okay, that should be continued. It is already ఉన్నదానికి లేకపోతే ఎక్స్పోజర్ అయ్యేదానికి we are getting protected అంతే because of the vaccine. It won't completely stop the development of cancer. But if you take the ratio, say it is almost 90% to 12%, okay, 10%, 9:1 ratio lo you will have the protection, okay. Yeah, so coming to this slide, the most important one which you are all worried. So potential impact of HPV vaccination is, it is the primary prevention agent. So who are at risk, everybody should get vaccinated who are eligible. And safety and approval wise, yes, it is completely safe, okay, so there is no problem. Hardly so far the side effects what I have seen for those who have given vaccine is the pain, obviously, because you are putting a needle inside the body, so pain will be there, okay. So without pain we can't give injection unless somebody is resistant to the pain, okay. So there will be some local reactions like redness, those things will be there. And hardly 5 to 10% of people, they may feel there is some syncope, some just giddiness, okay. So that is the reason why we make them sit, be in the same place for 15 minutes. We make sure that there is no syncope, no giddiness, nothing, and then we'll just send them away. And so far I have not seen, I have given hundreds of vaccines, I have not seen for anybody. Probably you may develop some 100 Fahrenheit fever, that is okay, fine, it will go away with the simple dolo or within 12 hours of time. So more than this I have not seen anybody, okay. So all are fine, it is completely safe, you can go with it, okay. So take home is, get vaccinated early, have good protection, get screened early, have good health. నేను ఇందాక చెప్పాను కదా, స్క్రీనింగ్ తోటి మనం ద ప్రీ క్యాన్సర్ స్టేజ్ కానీ ఆర్ ద వెరీ ఫస్ట్ స్టేజ్లో మనం క్యాన్సర్ని డయాగ్నోస్ చేయొచ్చు, ఎస్పెషల్లీ సర్వైకల్ క్యాన్సర్, ఫర్ విచ్ ఇఫ్ వీ కెన్ డూ స్మాల్ ప్రొసీజర్, ఓకే, క్రయోథెరపీ అని కానీ లేకపోతే లీప్ అని చేస్తాం అది కానీ, లేకపోతే సింపుల్ సర్జరీ కానీ చేస్తే మనం ఈ సర్వైకల్ క్యాన్సర్ని తగ్గించేయచ్చు. ఇఫ్ నాట్, కొంతమందికి మనం బ్రాకిథెరపీ అని చెప్పి ఒక రేడియేషన్ ప్రొసీజర్ కూడా చేయొచ్చు, ఓకే, విచ్ ఈస్ వెరీ వెరీ లెస్ కాస్ట్లీ అండ్ నో సైడ్ ఎఫెక్ట్స్ అట్ ఆల్. But once it becomes stage 2, 3, 4, then obviously it involves so much of cost, involves so much of time, family members' time, mental stress, and other side effects of treatment also. And today's vaccinated girls are tomorrow's healthy women. I hope everybody agrees with this one. So this is what. If any other doubts are there apart from this, I am ready to take.
Sir, if there is any health issue related to the sexual parts, can we take vaccination? Is there any gynec issues?
First you should check what is the reason for that gynec issue. Is there any infection? If it is infection, obviously you have to use the medication.
Sir, can a diabetes woman take the vaccination?
It is, diabetes means the woman must be more than 26 years of age, okay. Less than 26 means most probably now there is condition called MODI, maturity onset diabetes in young, okay, that is a separate entity. So if less than 26 years, then probably we should see whether the woman comes into type 1 diabetes or type 2 diabetes. Type 1 diabetes is insulin dependent, that is there from childhood, okay, like Wasim Akram, okay, and we have so many people. Those people can definitely take vaccine, there is no problem. But this is the age criteria, as I said, less than 20 up to 26. Ideally it is more than 1. Once you get married, there is no point in taking vaccine, that is what personally I feel. But up to 26 years you can go for vaccine, because sexual activity exposure will be a bit less.
Actually, many members don't know. It's not spreading, right? So we have to spread this and we have to be safe. It should be awareness actually. For girls and boys, everybody. I have taken 3 doses inter first year.